What are you seeing out there in terms of how China is responding to this unfolding crisis?
Well, I mean, the biggest thing that China has done so far, or at least certainly the most dramatic thing, is this lockdown of 35 or 40 million people in the cities that are at the center of the outbreak. That is a very, very aggressive response for a disease, I think, that so far, from what we know, has infected fewer than 1,000 people. But it does seem like, from everything we've heard from health authorities, from lawmakers who've been briefed by senior U.S. health folks, that China is keeping very much on top of this, that they're communicating to the rest of the world what's going on. It feels like a very different situation from those who lived through both than we had in SARS in the early 2000s.
And just to bring you some more details on this, France's health minister confirmed these two new cases of coronavirus in comments broadcast by BFM TV, saying that one of the patients had returned from a trip from the Chinese province of Wuhan, which is where this really has initiated. Do we have any sense, the cases in the U.S., in Vietnam, elsewhere, whether there has been any transmission from a person who has visited Wuhan to somebody else in that country? In other words, is it spreading specifically within countries outside of China?
So that's the thing we don't have right now. That is not happening as far as anybody knows. And I'm going to add a caveat to the second, but that is the reason why this is being considered by global health experts to be a China issue for now. I mean, in an interconnected society where we can get on an airplane and be all the way around the globe, in 18 hours, you are going to have cases that pop up everywhere where you can have air travel and you have borders and things like that. They're shutting those things down, but because this disease incubates for anywhere for days and days on time, you have people who left, didn't show symptoms, and are now showing symptoms now that they've arrived back home.
Do we know when they're contagious? Because there have been some reports that even with people who have the disease, have the virus, aren't necessarily getting fever, so can't be monitored, can't be screened in the same kinds of ways.
Right now, some of the reports we've seen have said along the lines of 10 days. I think that's something that we're going to get a better picture of as we go through this outbreak and do get the best possible sense as they trace contacts and try to figure out, okay, when exactly were you exposed? You have to figure out when someone is exposed, where and how, before you can kind of identify how long were they sick for. Because otherwise, you're looking for a needle in a haystack. You don't know to test someone who isn't showing any symptoms.
Next steps for China. What could they do next if they need to take it to a higher level?
Well, I mean, the biggest thing that's going on in China right now is more or less this extremely tight travel restriction in the middle of the biggest holiday there is there. I mean, this is 3 billion estimated trips that get taken. I mean, this is more or less in some parts of the country like canceling Christmas. It is a huge lockdown of economic significance, of personal significance, and obviously of health significance that's happening in that country.
Drew Armstrong, thank you so much for being with us and for all your insights throughout the day. Drew Armstrong, who leads our healthcare coverage here in the United States.